Ollie, why do you have more toast that I am getting?
Remember I told you I have a thing called cystic fibrosis?
Uh-huh.
Well, I look like everyone else, and I mostly am like everyone else, but I'm different on the inside. And there are a few things I have to do differently to stay happy and healthy.
Like eating lots of toast?
Well, that's one part that I don't mind so much.
Are you okay?
And I get a cough a bit because of my CF.
Can I catch your cough?
No, you can't catch it, because I was, born with it. I get a lot more coughs than someone like you. Sometimes I can get bugs that make me ill.
What are meant by bugs?
They're the things that give you coughs and colds. We all get them, but they can make me more ill than other people.
Why?
We all have sticky stuff called mucus in our lungs, but mine is thicker and stickier than yours.
Lungs?
Lungs are like 2 balloons in your body that you breathe with. The bugs find the mucus all nice and warm, so they live and grow in it.
Is that how you get ill?
Basically, yeah. I've got to have special medicine and physiotherapy to keep the bugs away and clear all the mucus.
Physiotherapy, what's that?
It means being kind of massaged really hard. I have to be stretched and bumped. I get pushed and pummeled and squeezed and dangled upside down.
You don't really have to dangle upside down, Ollie.
Not really. It's actually done by my mum. It's like being patted. And then I cough up the mucus. Then that sort of makes way for the medicine. It's only about half an hour, then I can go and play. My way is called percussion, but there are other ways of having physio, like a pep mask or bubble pep. You can even just bounce on a trampoline.
Wow. How did you get cystic fibrosis?
I got it from my genes.
Jeans like trousers?
Not those sort of genes. Genes with a G.
I see.
Genes are instructions that tell you what you're going to be like, just like ingredients that make a cake.
There's lots of different types of cake.
And there are lots of different types of people too. My mum and my dad both had the gene for CF, and it's because both of them had the gene that I got CF.
Oh, okay. Will you always have CF?
Yes, just like you'll always have a long nose.
I love big noses.
It's time for the nebulizer.
Who's that?
Think of it as a kind of breathing machine.
Hi there, I'm the nebulizer.
There's a lot of smoke.
That's medicine vapour. I inhale most of it, so it goes straight to my lungs.
Please breathe deeply.
It's actually just a little device that fits in your mouth. Sometimes I don't want to do my treatment because it's boring, but I have to do it to stay well. And I also have to take lots of medicine.
What sort of medicine, Ollie?
I have to take antibiotics.
That's a very long word.
Vitamins.
Hello, vitamin.
Enzymes. Capsules. And little round and powdery ones.
Is it nice medicine?
Well, it's good medicine and it makes me feel better.
Do you ever have to go in hospital, Ollie?
Just for a checkup, or sometimes when I'm not feeling well, I stay in for a while so the doctors and nurses can make me feel better.
During her research career, Dorothy Hansine Anderson studied many children who had digestive or breathing problems and also performed autopsies. She also found similar scars and tissue damage in the lungs and came to the conclusion that the lung and pancreas damage came from the same disease, which she called cystic fibrosis of the pancreas.
With every breath, we draw bacteria and other microorganisms into our lungs. Our airways are lined with airway surface liquid, or ASL, composed of periciliary liquid and mucus that traps debris. Hair-like structures called cilia sweep ASL, clearing debris and protecting against obstruction, infection, and inflammation. A protein called Cystic Fibrosis Transmembrane Conductance Regulator, or CFTR, lines the apical membrane of epithelial cells and transports chloride into ASL. Chloride and sodium in ASL attract water. In patients with cystic fibrosis, various CFTR mutations impair chloride transport, causing sodium and water to leave ASL, thus dehydrating airway mucus. The dehydrated mucus flattens cilia and creates an environment suitable for obstruction, infection, and inflammation.
A patient with cystic fibrosis is susceptible to infections of the lungs. This is due to a mutation that affects a protein on the surface of lung cells. Many different mutations can cause cystic fibrosis, but all of them involve a transmembrane protein called CFTR that functions as a channel for chloride to move in and out of cells. In this case, CFTR is less able to transfer chloride ions out of the cell compared to the functioning protein in people without cystic fibrosis. The channel is, in effect, locked shut. This inability to transfer chloride ions has an effect on the outside of the cell. In people without cystic fibrosis, there is a balance of chloride ions inside and outside lung cells, which maintains the right amount of water and salt ions in the mucus lining the airways. Cilia normally sweep the watery mucus from the lung lining, keeping the surface clean. In patients with cystic fibrosis, chloride ions concentrate inside cells and draw in water by osmosis. With less water, the mucus becomes thicker and cilia can't move. Flow is reduced, providing an environment for bacterial infection. But there are now drugs that can help patients. To find a drug, researchers tested over 200,000 small molecules to see if any would bind to the CFTR protein. Then, for each small molecule that had some binding ability, researchers chemically synthesized different variations of that molecule and tested them for the ability to improve the function of some types of mutant CFTR channels. They identified a drug that, when taken by patients with a certain type of CFTR mutation, binds to the CFTR protein, opening the channel and allowing improved ion transfer. This increases chloride ion flow and maintains a watery, clear mucus, which helps the cilia move more freely and reduces the risk of bacterial infection.
Cystic fibrosis is caused by a faulty gene that affects the production of a protein called CFTR inside your cells. Its production can be affected by what we call mutations. Imagine a CFTR protein is a new car being assembled on a production line and driven out onto the road. It all begins with the blueprints, which tell the factory how to make it. Then, the components are brought together and the car is assembled, before it passes through quality control, off the production line and onto the road, ready to drive. But what happens when the cystic fibrosis gene makes things go wrong? In your body, genes store the blueprints that contain coded instructions on how to make the CFTR protein in your cells. By better understanding the errors in this code, we can develop precision medicines that are designed specifically to treat these mutations. These are known as small molecule interventions, or SMIs. There are several types of mutation that can interfere with this process. The first are called class 1 mutations, which are indicated by an X on the end. These tell the cell to stop CFTR production too early. A drug called a read-through is designed to override the stop signal, and this means the cell can continue to assemble the components for the CFTR protein. As before, the car then passes through quality control and out onto the road. If you have a class 2 mutation, like delta F508, the assembly line will roll along as normal, but the protein can't be formed properly, so it won't pass quality control. An SMI called a corrector, like or can be, is designed to target this fault. This corrects the mistake in the blueprint so the protein can be properly formed and pass quality control. At this point, the protein is shipped off to the surface of the cell like a new car, leaving the factory. If you have a class 3 mutation, like G551D, or a class 4 mutation, like R117H, you have a brand new car rolling off the production line that might look fine, but it won't go anywhere. Inside, its fuel can't get to the engine, so the car won't start. The solution here is an SMI called a potentiator, like Kaleido. This can help restore class 3 and 4 mutations, so the fuel flows properly, the ignition works, and your new car is ready to drive.